right? Or some people once every 3 days, a bit constipated, but that's you. But now you, from once every 3 days, now you open 2 times a day for the last 2 to 3 weeks. Then you have change in your bowel habit. So it cannot be a few days, because if we travel to another place, we are on the plane, we are on the train, we don't move our bowels because that's the way it is. They're not used to the dirty toilets, especially kids. Kids don't like to use other people's toilets. That's why if they are not trained properly, kids, they go to school, right? Then they, they don't want to go to the toilet, and that's when they start to develop constipation. So, but this is something that the parents probably do not aware of, right? So not only you have to change your bowel habit, but the stools are now become looser. Stools are actually feces. Stools are becoming looser. That means more diarrhea type. Softly formed, loosely formed. Okay. And if you have blood in the stools, it's even worse. But it doesn't mean that you must have bowel cancer. For the young people, you can have some form of a disease called inflammatory bowel disease. So if one of you very young people come to see me, tell me they got blood in the stools, I won't be thinking about bowel cancer. I'll be thinking about inflammatory bowel disease. Okay, then the other one, when doctors ask you about, oh, I got blood in the stools, the doctors will ask you a lot of questions. One is like, how was the blood? How do you notice the blood? Is it mixed with the stools? Coating the stools? The stools are normal color, but now blood is coating just outside the stools. And then you look at the toilet bowl, it's pink water, right? And then you wipe yourself, there is blood on the toilet paper. Then most likely is due to hemorrhoids. But if you have anal cancer, anal, that means at the bottom, if you have anal cancer, yes, you can get bleeding from the cancer. But your cancer at the top here and top here, right, you most of the time don't get fresh. We call it fresh, PR, that means bleeding from your bottom. Per rectum, right, per rectum. Fresh blood PR per rectum, that means bleeding from your bottom. Right, so most of the time, it's bleeding from hemorrhoids. But I think people probably shouldn't be thinking, okay, I think it's okay, try to control yourself, it's bleeding from the hemorrhoids. I think you shouldn't think that way, right? Okay, so, yeah, so that one, we have already explained both, right? And this one is severe stomach aches. And also, if it comes and go, it's even worse, right? And if you're vomiting, worse. So there's something not right. And also your tummy swell up. Your tummy swell up when you don't eat, then the tummy started to calm down, settle down, and then you don't have the pain goes away again. It shows that something is seriously going on. Yeah, this is the one, right? Because it might be suggestive of your bowel is obstructed. It means it's blocked, right? So that's why, when you see a doctor, the doctor asks you a lot of questions. So we want to be in our head, think what is wrong with you? Okay. Now, what is your risk? Yeah, with an average risk, that means anyone, ordinary people, right, without any family history. We'll talk about family history later on. So ordinarily, you have 5% chance of developing a bowel cancer. 5%, once again, I told you already, in 100 people, 5 of us would get bowel cancer, right? And this one is to do with the fact, well, it just happened, right? And so 95% of the cancers, in the medical term, we call it sporadic. You might hear it, What does that mean? Once again, once we are born, there are a lot of environmental factors in terms of, environment and food, right? Other things, your job, all kinds of things. Some people cook with chemicals. So these are the things that can, cause some changes to your genes. And that is only to you, right? And the gene will not be passed to your children if you are a parent. So that's why it's called sporadic. And these are so majority of the colon cancer is sporadic. 95%. So 95%, 95 out of the 100 cancers is due to sporadic, and you cannot control, and you don't know what caused it, right? Now the inherited cancers, very uncommon, 5%. And these are really due to genetic changes. Genetic changes. I'll show you afterwards. To the children, to the grandchildren, right? So those are. I think unfortunately sometimes laymen, always think, oh, my father has got bowel cancer, so I must have screening, I must do this, I think I'm increased risk. Not really. the risk is not that high. But the genetic one, afterwards we talk about it, will be higher. So normal population, once again you talk about risk. Right? You can talk about different types of risk. What is a lifetime risk? That means in your lifetime. If you live until 50 years old, your lifetime is 50. If you live until 90 years old, your lifetime is 90 years old. So for males, right, the lifetime risk is 1 in 18. Right? What does that mean? Right? It is like 6%. You can look it up. 100 divided by 18 is about 6%. 5 point something. 6%. So that means, once again, 6 in 100 people. If you have 100 of you, 6 of you, the 6 of the people will be developing bowel cancer. So can you remember just now we say males are slightly higher than females, so it's 6% and 5%. However, if you have 2 first-degree relatives, who are your first-degree relatives? Do you know? Come, tell me, who are your first-degree relatives? Somebody want to say something? First degree relatives, who are they? Yourself, of course, and?
Immediate family.
Immediate family, so who are they?
Parents.
Parents, siblings, and children, that's it. Start from yourself, one generation up, your parents, one generation down. So, your children, so your same generation, your siblings, right, your brothers and sisters. So up one, down one. Okay, so it's a first degree relatives, are very close. Because you share quite a lot of genes with them. You share half the genes with your parents, right? Yeah. So for this one, your risks now increase from 6 or 5% to 17%. Right? These are the people that you really need to worry more than one person, and also young. If somebody is not under 45 years old, that's why always doctors ask you, how old was your mother when she had bowel cancer, right? Because when it's under 45, overseas is under 50, that means the genetic transmission is stronger, right? And also then you have first degree relative and 1 second degree relative. The chances is not as high as 2 first degree relatives. So second degree relatives, who are they? Can anyone offer me who are your second degree relatives? You can derive from our first degree relatives, right? One up, one down. So the second degree will be higher up. So it's your grandparents, your uncles, your aunties, and your nieces and nephews. Okay? So that's why you have to ask clearly. So we don't know what causes cancer. Honestly, all the cancers we really don't know. If we know, we would have found a cure. But most of the cancers, unless genetic, right? Genetic, we take it out. It's very rare. 5 in 100, right? Most of the cancers, all kinds of cancers, breast cancer, whatever cancer you have, if it just happen like this, we don't know the cause. And most of the time, it's not only one cause. It's a lot of causes. Your environment again, right? And other things, I'm going to tell you in a minute. So they are called risk factors, right? So what are risk factors? Risk factors are something that would increase your risk of getting the cancer, right? And it might not directly cause cancer. And some people say, I smoke, I'm a heavy smoker, why don't I get lung cancer? Yes, you have good genes, you're lucky, okay? That's it. And so, don't say that I don't have risk factors, so I'm not going to get it. No, cannot guarantee, okay? Because your body, again, is the genes. Okay? So what if you have the risk factors? So if you do have the risk factors, then you can modify. That means you can try to correct your risk factors. Things that you can correct. Things you cannot correct, nothing you can do. Okay? So anyone want to tell me the risk factors? What are the risk factors? Have a guess? Come on. Students, have some idea. I'm sure you know. Too shy. Too shy. Okay. What about the lady there sitting? I'm looking at you. ABC shirt. Yeah. Give me one risk factor. Have a guess. It's very common sense. Come on. Right. One very common one. In fact, the risk factors are very common to most of the cancers. And to be honest, we don't know why. But because they are common, so smoking is one of them. Alright, so anyway, I think you're too shy, so I'll show you the slide. Age. Well, I told you you can't change your age, right? You want to get younger, but you cannot. So cancer, all kinds of cancer, is an aging disease. So in fact, there is this scary statement came from the UK cancer research. Very scary. Those people who were born after 1960, who were born after 1960, put up your hands. Put up your hands. Born after 1960? Right, right, okay. Well, good news, you are young, right? Bad news is that 1 in 2 of the people that born after 1960 will get cancer. One form of cancer to another in their lifetime. Scary or not? 1 in 2. That means you have it or you don't have it. You have it, you don't have it. 1 in 2. It's very scary. So cancer is on the rise. And because we are now getting older, we live to longer age. So, so now we are going to get more and more cancers. Okay? So as I told you just now, that in overseas, 90% of colorectal cancer occur in people older than 60. Whereas in Malaysia, it's over 40 years old. So as Malaysians, I think we have more unhealthy, habits, right? And I think it's food, mostly, right? And also slightly higher in males and race, right? The black people in United States have a higher risk of bowel cancer, and they also die from it. Physical inactivity, right? I think a lot of people don't understand how important activity is. So this is something the young people, also the slightly older people can do. So the younger people nowadays, I promote campus health by asking people to walk up the stairs. What happened to the young people? One floor also go to the lift, especially KB block, right? KB block, one floor also let's go to the lift, and it's cramped. And waiting for the lift, by the time you wait for the lift, you could have just walked out, right? So please, walking up the lift, right, is that you can do anytime, during your studying hours, during your working hours, right? So you don't have to walk up 10 flights. You walk up 2 flights, you say, I'm tired now. I never walked upstairs, but I'm going to start now after Prof. Shelley's talk, right? You can walk up 2 flights and then take the rest. If you're on 10th floor, then get out and then go to the lift. And then you come down again after lunch, right? Okay, walk another 2 flights of stairs. Then in one day, you have already walked 5 minutes of exercise. And exercise is considered, walking upstairs is considered a vigorous, it's not a mild, walking mild exercise. It's a vigorous exercise. So please think about that. And it's the number 1 killer, right? Physical inactivity, right? Why? Because it leads to the next thing, overweight, right? Now we have too much food. We have good food in Malaysia, it's the heaven place for food, right? Yeah, Malaysian food is very delicious, but it's unhealthy, most of it. So people are getting more and more overweight, and Malaysia is the fattest country in ASEAN. Fattest country. Do you know that? Yes. And also, if you are fat, eventually you'll get, diabetes. When you get diabetes, you are going to get heart disease. You're going to get stroke. Right? So all come together. So I think it's important to prevent obesity. And also in the future, it's something that people now becoming more and more aware. Your liver is also fatty, right? When the liver is fatty, sometimes inflammation occurs after some time, and the liver can become cirrhotic, and it's hard and fibrous. Then if you have cirrhotic liver, even though you don't drink alcohol, you don't do anything extra, you don't have hepatitis B or C, you can get, liver cancer. And in the future, liver cancer is going to be the number 1 due to obesity, especially in the States, USA. Right? USA is about many people with obesity. So it's a scary disease. Also, it's a non-communicable disease, right? Okay, smoking, we say that it can cause lung cancer, but it can also cause bowel cancer. Alcohol, so don't drink too much alcohol. And don't think alcohol is good for you. Red wine is very good for you, so drink. No, I think if you don't drink, it's better not to drink, right? And also nutrition. feet, it's not feet, meat that, beef, the red meat, beef, lamb. Malaysians probably don't eat a lot of beef and lamb, but I think it depends on what you want, right? So the processed meat, the fats and sweets is not healthy and also low in fiber. So in fact, you should take every day 5 servings of fruit and veg. 5 servings. You can go to the internet, look at the serving, because serving can be quite difficult to, a small fruit is 1 serving. If a big fruit, a grapefruit is big, 1/2 maybe, but it's quite tricky, you have to get used to it. How many, a few florets of, cauliflower is 1 serving. So you should need, in fact now recently they said that you should take 7 servings, not 5, and actually quite difficult to achieve. During lunchtime you have laksa, right? Laksa has got very hardly anything, maybe less than 1 serving of vegetable. And then after that, at night you have to eat 4 or 5 servings. Most of us don't do that, but I think you should try.